welcome to WCN Pre-Congress interviews. My name is Aditya. I'm a transplant nephrologist from Boston, and I have the pleasure of being with Dr. Helen Noble. She's a reader at Queen's University Belfast for the School of Nursing and Midwifery, and we will be talking to her and getting to know what she's going to be talking about at WCN. Welcome, Dr. Noble.
Hello.
How are you today?
I am very well, thank you. I'm delighted to be here with you.
Yes, me too. It's a pleasure to have you. So let me begin with asking you, what education, training, or other preparation did you need to get into this field?
Thank you. Well, I firstly qualified as a nurse many years ago, and I quite early on entered the nephrology speciality. And when I entered that speciality, I worked mainly in London as a ward manager and a matron, and we had modern matrons in those days, and then as a senior clinical nurse specialist. And I was always really interested in how people negotiated deterioration with kidney disease and also the approaching end of life. So I completed additional training in these areas and eventually did a PhD, which explored the experiences of people who decided not to dialyse. And so as a nurse, and all nurses will know, and doctors too, all healthcare practitioners, we're regularly doing some form of training. And when I was a more junior nurse, I'd completed a counselling course at the Royal College of Nursing in London. And I also completed a module at City University that was focused on care of the dying. And then my PhD, well, all of this lay the foundation for the research I do today, which is centred on helping people with kidney disease and their carers to live the best life possible.
That's fascinating. What are you working on now, and what do you find the most interesting thing about it?
Okay, so I'm really very interested in well-being and quality of life, which I think cuts across the whole of humanity, really. But my hope is that my work can help people who have kidney disease to live a really happy and fulfilled life, just as we'd all wish for each of us and our loved ones. And I've helped with implementation and led a number of interventions in renal units, including such things as reflexology and arts-based interventions with some really positive results. And what we found was that participants generally very much enjoy taking part in these activities and asked for more. And in the arts study in particular, we found that patients were able to enter a flow state where they became really engrossed in the activity and their time on dialysis passed very quickly. And I think this is of real important consequence for people on dialysis who suffer existential boredom, being placed on a machine for up to 12 hours a week. And this ability to be mindful through the arts activity, I find really exciting, because this is going to impact on the neuroplasticity of the brain and will lead to all the benefits of mindfulness and mindfulness meditation. So the art acts almost as the meditation. So ultimately, this will lead to reduced rumination that we know is problematic in the renal population, decreased depression and anxiety, which is also very prevalent. It will lead to reduced stress and other physiological responses, such as decreased or reduced blood pressure and heart rate. And I'm very interested in mindfulness and meditation, and that's another area of research I'm involved in.
Beautiful. What continues to inspire you to work into this field every day?
The key things that inspire me are mindfulness, meditation, and compassion. And I believe strongly that implementing mindfulness-based interventions, which include these components, are going to lead to long-lasting changes that can really help people and enable people to be more joyful, more happy and contented, to have improved relationships, and ultimately the ability to accept that death comes to us all and it's not something that needs to be feared.
Would like to transition over to what your talk is about at WCN. Could you please just tell us a little bit about that?
Okay, so yes, at WCN, and I'm delighted to have been invited to speak. Thank you very much. I'm going to be speaking about renal palliative care and making decisions not to embark on dialysis. As I said, it's an area I've been working in for a substantial length of time, having done my PhD in that area. I'm going to talk a little bit about that PhD. And what we found, and about one of the first services that we set up to support people who are making decisions not to have dialysis in London. It's a topic I've been interested in for many years, and I see this as a topic that's really very close to my heart, and I believe that integrating this topic with mindfulness practices is going to really enable people to have a more fulfilled and satisfying end of life and a better death, ultimately, that will impact not only on the patient but carers too.
What are the challenges that you found while doing this research? From my experience as a nephrologist working in the dialysis, there are so many things that are priority to us: administration, patient, but sometimes you miss out on the parallel part of actually knowing how the patient is doing. So it would be really nice to know what challenges you've faced.
You've hit the nail on the head there. The units that everyone works in, they're always very, very busy, and there are people coming and going throughout the day. And so having some of these in-depth, difficult conversations, it can sometimes just be impossible. And I do teach renal nurses actually sort of over 9 months of the year. We run a renal short course. And so I hear time and time again from the nurses that they wish they had more time to talk with patients, and they also wish that they had more communication skills training to be able to have uncomfortable conversations. So I think one of the things that's so needed is more specialist communication skills training. So that's one point. And then the other thing that makes things difficult is that sometimes as healthcare practitioners, we don't want to have the difficult conversations with patients and carers because perhaps it stirs something in us. Sometimes we're really poor at having these conversations with our own families, never mind with the patients that we care for. So I think we really need to become curious about that and perhaps aware of the feelings that arise in us when we know that we need to talk to people about deterioration and perhaps end-of-life care. And this is really important because we know that patients tell us they want their doctors and nurses to talk to them. They want them to talk about prognosis. They want them to be honest. And often we're not. We try to steer clear. We're often optimistic and too optimistic when patients are sitting in dialysis units and they know that they're deteriorating, but no one's saying anything about it. And we recently carried out a study actually at Belfast Trust in Northern Ireland, where we implemented an advanced care planning procedure, and we had some fantastic results from that, with patients and carers saying what was so helpful was that the discussion took place. And once the discussion took place around what patients might prefer as they deteriorated, they then felt happier talking to their loved ones about deterioration, and their loved ones were happier to have the conversation. So I think there's huge benefits to be had by being transparent, honest, and open.
Well, I learned so much talking to you, Dr. Noble, today, and
Thank you so much.
yeah, I'm sure that people that will be attending or watching WCN would learn just like as I did today. It was such a pleasure talking to you. Thank you so much for talking to us.
Thank you so much. It's my pleasure too, and I'm delighted to be able to share some of our work, and I look forward to meeting so many colleagues online in April. Thank you.